welcome to Stemcells.news. This is Brady Theodore, the Gotti, bringing you news you can trust. Hey, today I want to read an article to you from DVC STEM by Dr. Louis A. Kona, MD, Medical Director. What is stem cell therapy? Stem cell therapy is a form of regenerative medicine designed to repair damaged cells within the body by reducing inflammation and modulating the immune system. This phenomenon makes stem cell therapy a viable treatment option for a variety of medical conditions. Stem cell therapies have been used to treat autoimmune diseases, orthopedic conditions, and traumatic injuries, with studies conducted on use for Crohn's disease, multiple sclerosis, lupus, COPD, Parkinson's, and more. While stem cell therapy does not necessarily provide a cure for these conditions, the premise is to allow the body to heal itself well enough to mitigate the symptoms of the conditions for long periods. In many cases, this effect can substantially increase the quality of life for patients. Where do stem cells come from? Stem cells can be obtained from many different sources. These include adipose or fat tissue, umbilical cord tissue, placental tissue, umbilical cord, blood, or bone marrow. How are stem cells administered? Stem cells can be administered in a variety of fashions. IV stem cell therapy, intravenous administration, intrathecal directly into the spinal canal, site injections into problem areas, knee, hips, hands, etc. How does stem cell therapy work? Stem cell therapy is a non-invasive treatment that aims to replace damaged cells within the body. Mesenchymal stem cell therapy can be deployed systematically via IV or injected locally to target specific sites, depending on patients' needs. Stem cells target inflammation. The therapeutic uses of stem cells as a potential therapy for a variety of diseases has been immensely explored. The number of clinical trials conducted with mesenchymal stem cells has increased exponentially over the past few years. Stem cells have a unique intrinsic property that attracts them to inflammation in the body. Studies have shown that stem cells can regenerate damaged or diseased tissues, reduce inflammation, and modulate the immune system, promoting better health and quality of life. Mesenchymal stem cells do this by influencing tissue repair via Pasrin effects cell signaling in order to change the behavior of existing cells or direct cell-to-cell contact. MSCs are able to migrate and seed specifically into damaged tissue sites where they can differentiate into functional cells to replace damaged or diseased cells. What are stem cells? Stem cells are cells that have not yet specialized in the body, meaning they have not grown to a particular type of cell with a specific function, e.g., muscle cell, skin cell, etc. The two defining characteristics of a stem cell are perpetual self-renewal and the ability to differentiate into specialized adult cell types. Mesenchymal stem cells have the ability to differentiate. The stem cell can become many different cell types in the human body. The process of stem cells maturing into new types of cells is called differentiation. The process is most critical aspect of some stem cell therapies, as the cells become the type of cell required for one's body to heal. Stem cells are also self-replicating. This ability allows the cells to multiply into identical copies of themselves. For example, if stem cells were used to treat a neurological injury, Cells administered during treatment could become nerve cells and then replicate to create exponentially more nerve cells on their own. This ability to duplicate drastically increases the effectiveness of stem cell treatments over time. Stem cells age as we do. Stem cell numbers and effectiveness begin to decrease as we age exponentially. For example, stem cells from a person in their 20s are not nearly as high quality as the brand new cells sourced from umbilical cord tissue. How is stem cell therapy utilized? Stem cell therapy may be able to treat orthopedic conditions as well as autoimmune diseases, with studies conducted on use for Crohn's disease, multiple sclerosis, lupus, COPD, Parkinson's, and more. Stem cells do not necessarily provide a cure for these conditions. The premise is allowing the body to heal itself well enough to mitigate the symptoms of the conditions for long periods. In many cases, this alone allows for a substantial increase in quality of life for patients. Will the body reject stem cells? Cord tissue-derived mesenchymal stem cells do not have any risk of rejection within the body. They are youthful, immune-privileged, unidentified cells that have no rejection in the body because they have not yet to be claimed. There are no blood products associated with them either, removing the need for a donor match. They are universally accepted. These cells seek out inflammation in the body and begin to heal the damaged tissue. Mesenchymal cord tissue-derived stem cells have been administered thousands of times at clinics around the world without instance of rejection. Cord tissue-derived stem cells explained. These are stem cells derived initially from umbilical cord tissue. Cord tissue is the insulating material surrounding the vessels of the umbilical cord. The cord tissue can contain millions of different types of stem cell that goes on to form a person's nervous system, sensory organs, circulatory tissues, skin, bone, cartilage, and more. Why use umbilical cord tissue? Cord tissue is rich in mesenchymal stem cells, potentially used to help heal, regenerate, and treat a variety of conditions. Mesenchymal stem cells derived from umbilical cord tissue have shown the ability to avoid a negative response from a person's immune system, allowing the cells to be transplanted in a wide range of people without fear of rejection. These transplants may have the ability to vastly increase the body's natural healing abilities and have robust anti-inflammatory and immune suppressive responses. In conclusion, previously untreatable neurodegenerative diseases may now possibly become treatable with advanced stem cell therapies. Regenerative medicine and its benefits may be the key to prolonging human life, although more research may still be required. With that said, I would like to remind everyone that I am not diagnosing, curing, or treating any illness or disease, and please contact your physician before starting any new drug therapies. If you need more information about stem cell therapies, please visit the link somewhere in this video or description. And thanks for joining me, Brady Theodore the Gotti, at stemcell.news. News you can trust.